The difficult thing is starting to do a new one.
Darkness hangs over Jesse Valdez.
It always had been lingering out there.
His mom worries about him every day.
Jesse is 41. We've been dealing with this for 20 years.
I could call it stained glass forever.
Finding the right treatment has been difficult.
I just want it to be all positive.
We still have a long way to go.
But the state has a plan.
We've been dealing with this since the 1980s, and finally we're having honest conversations about how important this is.
Nevada is in a crisis when it comes to mental and behavioral health. 1 in 5 adults in the U.S., nearly 44 million people, will face some sort of mental illness in a given year. And here in Nevada, we just don't have enough resources to help.
Yoda monkey with the green ears.
Jesse says he first felt a darkness overcome him when he was a teenager. He was diagnosed with schizophrenia when he was 20.
And I cry, but it's tough. But I can cry right here, and it's fine with me. It's just knowing that I have to go to sleep after the day and battling for a couple hours, maybe.
Jesse's mother says it's been a long road to find the right services for her son.
He hiked up a little bit, holding the baby. He just is so at peace.
Ryrie Valdez finds comfort with Kathy Baxt, whose 36-year-old son also has schizophrenia.
There are resources, but they're not enough resources.
The Baxt family lives in Carson City.
There are no private psychiatrists in Carson City. The only way you can get a psychiatrist is through a behavioral health office or the hospital. You can't find one otherwise. The services that are available in Carson are so minimal, it's a crime.
But the problem persists throughout Nevada.
We need an education about mental health because people do think our sons are crazy because they are in their own way.
In Reno, one of the largest behavioral health service providers closed its doors near the homeless shelter last year. It cited financial shortage with the government funding partners as a reason why. Since then, Renown opened the Stacey Mathewson Behavioral Health and Addiction Institute. Charles Dwart with the Community Health Alliance, which provides mental health services in Washoe County, says Reno is lacking resources.
Oftentimes, the first contact somebody has who's experiencing a mental health crisis is with law enforcement, but they don't have a place to take these patients. And so quite often, if they don't end up in jail, they end up in a hospital emergency department.
Governor Steve Sisolak made mental health a priority and mentioned it during his State of the State address.
I am recommending we add new staff who will focus on supporting mental health and substance abuse programs.
The legislature is set to take up 4 mental health bills this session, proposed by 4 regional behavioral health policy boards created in 2017.
It's horrible for the people of Nevada, and what we need to be doing as state leaders is really addressing this issue.
AB 66 would create a stabilization center, a system modified after one in Phoenix. It would provide psychiatric care 24/7, freeing up first responders, jail space, and hospital beds.
Almost $300 million in hospital savings were achieved by having these types of services available.
Better services could drastically change our community.
We're a tourism state. It's scary for people in our communities to be trying to visit Nevada, encountering people that are uncomfortable, create discomfort.
Grandfather taught us about love.
But for people like Jesse Valdez, family has been a stopgap when resources fell short.
Really, family is what it's all about.
But plenty of people need services that currently don't exist. In Reno, Kim Burrows reporting.